Thank you, Mark, for inviting us tonight to speak at your chat, and for Teresa to follow it up for the opportunity as well. So, as you probably realise now, I'm Adrian Campbell. We're from the Rotary Club of Camberwell, and I have great pleasure tonight to bring you up to date on what's happening with the ROMP program, and it's really a multi-club, multi-district Rotary initiative. And obviously on behalf of our steering committee that I'll talk about in a moment. Most of you, we've just talked about some of the acronyms in Rotary. The organisation is full of them, so you've got another one to learn about tonight, which is the Rotary Outreach Myeloma Program, or ROMP. To give you a quick heads up, the purpose, put simply, is to put or deliver hands-on support for people in regional Victoria who are living with myeloma, and I'll talk about myeloma in a moment. ROMP has been initiated by our club in a formal collaboration with Myeloma Australia, and they're the only myeloma-specific charitable organisation in this country. The core aim of ROMP is to provide that support for the work of Myeloma Australia by bringing additional Rotary volunteer support for myeloma patients and their families, and also their carers. And I'll speak on that as we work our way through the presentation. Let's hope the slide works. It doesn't for some reason. Oh, here we go. Our program started last year in 2019, and we established this steering committee that you can see of fairly experienced Rotarians. Don, our past district governor and chair, Peter Allen, myself, Teresa and Lyndon, and also some reps from Myeloma Australia are part of that group as well. So they're, quite senior people there, including the CEO, Stephen Roach. My myeloma story started about 10 years ago when I was diagnosed with the disease. So I come to you tonight, I guess, to talk about this opportunity, but I also talk with some lived experience of having to deal with myeloma. And in that capacity, hopefully that we can help others who are in the same position. It's important to know that ROMP is a certified Rotary 100 project. So it's part of the celebration, the centenary celebration of Rotary in Australia and New Zealand. And of course, there's a Rotary Congress coming up in Melbourne in 2023. So it's significant to have that certification. And the good news here is that participating Victorian Rotary clubs can actually adopt the ROMP program as well for that R100 purpose. So you're probably wondering what myeloma is. I know, Carol, you know what it is, but it's basically a blood cancer that impacts your plasma cells in your bone marrow. And some people call it a bone cancer for that reason. In simple terms, it plays havoc with all the blood in your body and also your immune system. So fatigue and tiredness are constant companions when you have myeloma, and patients are prone to infections because you have low immunity. So there's been a lot of research into what causes it, and doctors don't know. That's the simple answer. They don't know what causes it, and there's no cure for it either. So the good news, though, is the new generation drugs that are coming out now, particularly from the US, give patients and their families a lot more hope for a longer survival with this. It's a relatively uncommon cancer, myeloma. It ranks just inside the top 20 cancers in Australia, and it's much smaller than other blood cancers like leukemia and also lymphoma. We estimate there are about 18,000 myeloma patients in Australia, with 1,800 new ones diagnosed each year. So that's a bit under 40 people a week in Australia are diagnosed with myeloma. It affects men slightly more than women. Generally, everyone that gets it is over 40 years of age, but it's more typical to get it when you're over 60. It can present in lots of different ways. Mine presented with a sore lower back, but there's lots of other ways that myeloma presents itself, but generally through infections, tiredness, fatigue. You're not feeling right, there's something wrong with you. So but in my case, they found it with because I had a sore back, basically. If you extrapolate those numbers down from a national to a state level, that's about 4,500 patients in Victoria and 1,100 cases in regional Victoria. When we talk about the myeloma community, we're really talking about not just the patients, but all their families, all their partners, their carers, their friends, their medical people that share that experience with them as well. So when you add all those people into it, it means that there's probably a figure of over 5,000 people in regional Victoria that constitute that community. For background, the Myeloma Foundation and the Rotary Club of Camberwell have been joined at the hip for 20 years, as past District Governor Don just mentioned earlier on. Our previous member on the left-hand side, Bob Moran, who passed away recently, and the current president, Brian Rosengarten, were joint founders of the foundation. And they came together when both their wives were diagnosed with myeloma. So they got together and formed the foundation, which started in Victoria, but then became Myeloma Australia. And our club at Camberwell has always proudly been represented on the Myeloma Foundation board. And past President Peter Allen still sits on that foundation board today, after 20 years. When we started this exercise, we carved Victoria up into the 9 state government jurisdictions. The 10th region there in grey in the middle was Metro Melbourne. But our goal was to look at providing myeloma support group locations in all these regions. Some would be new ones or it would be to bolster existing groups that are already in place. But the aim here is to try and get all myeloma patients in regional Victoria within a 1-hour drive of a support group. When you dive down into those regional numbers, you can see your area there in Gippsland has the biggest regional population of those jurisdictions. And we estimate there are probably 195 to 200 people in Gippsland that have myeloma. And if you look on the right-hand side, yes, that's the prevalence of myeloma patients in total. So if you rank them, as I said, Gippsland's the biggest population, and the Wimmera area around Horsham is the smallest one. When you look at these 9 regions in a little bit more detail and overlay a ROMP structure, we see the outreach program like this, setting up a team, if you like, a ROMP group in each of those 9 regions. Our good friends and Rotarians at Horsham, past President Don Perry and Gary Green, were the first group that were established last year. That was before the pandemic hit. And so really that was the start of Wimmera ROMP, which was the, and since then the Rotary clubs of Warwick, Nabil and Neil have also joined the initiative. And we're getting really good support from a lot of different areas. In Central Highlands around Ballarat, we now have representation there with the Rotary Club of Alfredton, and also in the Loddon Campaspe area, which is around Bendigo, the Rotary Club of Eaglehawk looks as though they're joining us as well. When word spreads pretty quickly in Rotary when you're on a good thing, and we've also presented to the Rotary 9780 leadership group in a similar fireside chat to this, and that covers all Western Victoria from the Mallee, Wimmera, west of Ballarat, the great southern coast area of Warrnambool, and then also into Geelong. So we're hopeful that we're going to get participating clubs in each of these nine regions. So you can see what the whole objective is here and how it's forming. It's to cover all of regional Victoria. So all myeloma patients can live with an hour of a support group. So we're, when you look at Gippsland, as I said, we are looking for a minimum of 2 clubs in Gippsland to represent ROMP, to become Gippsland ROMP, if you like. And hopefully after the presentation, maybe there's another one. We will get that support. Excuse me, I'll just have a drink. If you look at the frontline forces in the support group, it's really the highly respected and professionally qualified myeloma nurses. Myeloma Australia has these nurses. I think there's over 20 around the country, but they specialise in giving counselling support for myeloma patients. And in regional Victoria, there's 2 of them at the moment. And prior the pandemic, they had support groups that were in place, and I believe there was one in Traralgon. And so we'd be looking to, bolster that even further. But anyone who has had a cancer diagnosis, or they know of someone that has, would know, the uncertainty that comes with it. And so when you have access to a special support group like these oncology nurses, it's really like an important lifeline for counselling, and also to talk about treatments, etc. When we call them the gold standard, because they're a gold standard of support. With the myeloma support groups, it's important to say that there's no Rotary role actually sitting in and participating in these groups. That's the domain of the myeloma nurses and also the patients and their families. So what we're talking about here is the Rotary role is really one of facilitating these support groups, either helping to create new ones or bolstering existing ones. Regional cancer centres are really important to engage in this ROMP project, and this one here on the slide's in Horsham. And obviously they're important because that's where all the cancer treatment takes place. And I'm aware of your Centenary House building in Traralgon as well, so that could well be a key location, and to improve it even further, bolster it even more. So getting back to a little bit about the structure. So this is how we see it working. The 9 different districts having a minimum of 2 Rotary clubs in each. That would give us 18 clubs. And in the middle is our ROMP committee, like with Teresa and Don and myself and others from Myeloma Australia. So we call that the forum, and we meet every month and we get input from each of the different ROMP groups that have joined us so far. So we anticipate with that there's going to be much fellowship as we focus on activities, and also feeding back good ideas that happen. As I said, we Zoom every month. It's structured with an agenda and meeting minutes to make sure we're governing the initiative properly. And our steering committee really runs that, but it's not. It's looking to get feedback from each of those Rotary clubs in those districts. We were speaking at the start of the meeting about the pandemic, and it's funny because we've got a slide in there about it as well, but it is true that during the pandemic we've all been cut off and separated and distanced from getting involved, but really in a lot of other respects we've never been better joined and connected. And our club too at Camberwell, the membership has actually grown during the pandemic. The membership participation at meetings, I think we've probably never seen those kind of figures either. So it's enabling people to get involved, albeit in a different format. But the Zoom technology has given us an opportunity to move quickly with this project and spread our wings a lot further with ROMP to give us this reach. So I just wanted to summarise from here just a few concluding slides that talk about what are the principal aims or purpose of the project and how can local Rotary clubs, say, like in Gippsland, get involved to help the myeloma communities in their towns and regions. So firstly, we want them to be willing to provide hands-on support in your own myeloma communities. So that means helping to facilitate the support groups in each of the regions, wherever there's a need. So it might be to bolster existing ones or create new ones where there is a gap. We need hands-on services for local myeloma patients and communities. As an example, that might be offering to transport the patients to medical or pharmacy locations to seek their treatments. And as I said, we see engagement with the local cancer centres as being integral to that support program. And a really good example here was in our ROMP test market at Horsham last year, where the Rotary clubs went straight to the Wimmera cancer centres, and they received very enthusiastic support. Given the uncommon nature, of the cancer, there's a real need to lift the awareness of it and provide the nurses and the support groups. So we see this program being able to accelerate that awareness in regional communities. And that last bullet point is one of the key objectives of our program. Other hands-on services that local Rotary clubs could provide would be to promote the services of the Foundation, Myeloma Australia. That might be in advertising, supporting local media or the local cancer centres to ensure that the Myeloma Australia printed material and brochures are available to those that need it. We all know the power of one Rotary club to help local communities, but when you get a collection of clubs combined in a common purpose, this really gives even greater momentum as a force for good in the communities where we live. And in this case, we're talking about the myeloma communities within the regions. The Rotary International President-elect Jennifer Jones said in a recent conference that there were two key elements of Rotary. That was service and fellowship. So supporting the ROMP project forum, we believe, will provide both of those in a large amount. Great fellowship and amazing service opportunities going forward. And we know that'll work because it's already working in Horsham. Looking forward, we also believe there could be a much wider Rotary involvement against myeloma. So we're not talking about just at the moment, but if you look at a big picture, we can imagine our mantra of a world without myeloma being achieved in the future. I wanted to say we're not looking for money to support the project from regional clubs. It's all about Rotary service, good old-fashioned Rotary community service. And that's what we're all good at doing. Earlier, I spoke to you about building awareness, and as that being one of the key objectives. And the good news is that we're working on that. We're working on how to build our awareness and the community engagement. We have a number of new and existing events on our radar for 2021. The first one there on the left, the business of winning corporate lunch, has been a successful vehicle now for close on 20 years. It's been a joint event between our club at Camberwell and Myeloma Australia. We hold it each year at the MCG, generally with well-known AFL identities. So what we're doing, planning to do next year is stream that event live into regional cities and towns next March. And we can send all the details of that. But we believe that's going to be a great way to build the myeloma community cause around regional Victoria. You'll have to excuse me, I've got a bit of a cold. The other things we're looking at is local bike events. Maybe a veterans bike race, for instance, would be an example, or a community walk around Victoria is another idea that we're thinking of. All these ideas are discussed in our forum each month. And May next year, the second quarter activity, is always a big one because it's myeloma month in the month of May. And we're working on a big community project around a theme of the 38 people every week that are diagnosed with this cancer. We've also developed a basic website to get started. It's www.romp100.org. Excuse me, and you can find a lot of information there on the website about ROMP as well, and some of the stuff I've been talking about tonight. And also we're working on our digital marketing plans to ensure that we've got a good presence around that in the future. But that really concludes the presentation tonight. Sorry I've run out of voice a little bit, but on behalf of all our committee, thank you again, Mark, for inviting us and providing that opportunity. And as I said, we're looking for a minimum of 2 clubs in Gippsland to get on board. And I'd be happy to take any questions if anyone has any.
Thank you for that, Adrian. That is absolutely fantastic. You know, I've found out a little bit more tonight too. And look, I'm sure some of the others have some questions. But Frank, when you're saying you're after 2 clubs in the Gippsland area, I mean, the immediate thought for me would be, you know, sort of one right out, you know, sort of Sale sort of into the district. And then one closer back, but that's still not going to equate to sort of the 1 hour trip for any one person. So I'd say long term, probably 3 or 4 sort of potentials would be needed.
It's a good question, but like the example in Wimmera, for instance, we've got Horsham, Warwick, Nabil and Nils. So we've got 4 clubs in that region that spread out. So it makes sense to me, you know, if we had 4 clubs in Gippsland across that geography, and I know there was a myeloma support group already established in Traralgon, so that's probably also a good spot to have one as well. But you know, I think if we can get 4 and cover it, as we've seen, it's the biggest area of the state in population and probably geography as well, or close second. So if we can get that support, that's good. The clubs that are closer to Melbourne, you know, they really, I guess they get support from the metropolitan hospitals for myeloma, like I do, for instance. I live in Melbourne, and it's easier to get access that way. But I think the people that are particularly struggling are those in the rural and the regional areas. And that's why our focus has been in regional Victoria. And and you know, we know if it works in regional Victoria, it's also got potential to work in, you know, regional New South Wales and Queensland for exactly the same reasons, and all the other states. But Victoria is our focus, and that's why we really want to get this established and get it humming along. And it sounds pretty exciting next year, because with all these different community awareness programs that are happening, you know, people will start to know more about myeloma, like they know about Movember and, you know, breast cancer and all the other ones that are out there. So, you know, all we're trying to do is build awareness. And because the local Rotary clubs are well established in these regional areas, it seems to me a good place to start, because they have the contacts, they have access to the cancer centres, to the rooms, to the community centres, etc. And all those locations are important, you know, for this cause.
And when you're sort of saying, the clubs, you're not chasing money from clubs. It's just the good old service. And so I take it that's sort of the support, as you're saying, the picking up of somebody, taking them to a centre for one of the meetings. Is that the sort of stuff that you're after from clubs?
Yeah, exactly. I mean, we say that it's quite a modest level of support. We're not. We understand a lot of the clubs have got their own, projects that they're working on, but this is more like a modest support that's required. Like it might only be one or two people in each club, for instance, or one person that would be able to do that. So we're trying to sort of build this story around myeloma and then build the community story. And I think it's an opportunity for Rotary clubs to build their own story, about what they're doing in communities to help the cause. Yes, Teresa.
Sorry, one of the other activities would be Myeloma Australia has many publications about myeloma that could be delivered by the Rotarians to doctors, surgeries and hospitals and other centres of health, providers, so that there is material that people can learn about myeloma and understand.
Yep, that's a good point. And the clubs that are in there at the moment around Ballarat and also Horsham, we're currently putting together these folders, and the folders have the myeloma brochures that are in them. There's probably 4 or 5 different brochures that talk about myeloma if you've been diagnosed with them, about treatments, about drugs, about peripheral neuropathy, which is something you get, myeloma patients get in their hands and their feet. It's like pins and needles. It's quite a common thing for people with myeloma. So they're brochures that has information about the 1-800 line. It has the information to contact the myeloma nurses by email. All that kind of information is really what we're, as Teresa was saying, we want to be established, particularly in the cancer centres and the support centres, because that's where people are going to be, treated. So, Carol, did you have more to add on that, Carol, with your experience?
Look, anything that can be proactive with people when they're newly diagnosed is vitally important. I see a lot of people who are freshly diagnosed and they are completely overwhelmed. And I say, have you been referred to the Leukemia Foundation or to Myeloma Australia? And they go, oh, I got a pamphlet about that, but I haven't had time to contact anyone and it's just too much. So anytime you can get someone who can actually sit down with them and go, look, it's a 1-800 number. Do you mind, we'll give them a ring now, and all they need is your name and your number and they'll ring you back. And it's, it's not a daunting process, because that first contact is so hard for new people. So having if we can get ROMP where Rotarians, as you say, can provide those packs and sit down and talk with someone and say, we do a support program in this area. You probably don't want to come for the first few weeks or whatever, but it's here. And what can I do to help is just, would be phenomenal for people, particularly out in the regional facilities. I mean, we're lucky in Traralgon, we have the Gippsland Cancer Care Centre, but you go to Orbost, I mean, they don't even do chemotherapy, so you tell someone in Orbost that they've got a 2-hour drive to have chemotherapy. And it's just a completely overwhelming process. So getting support and information out there is a real significant step in helping people to cope.
Yeah, it's a very good point, because it is very much an overwhelming kind of experience. It's kind of like a roller coaster that you're on, and sometimes the basic things like learning a little bit about the information. After you get over the shock, it's what can I do to help, and it's not only the patients, it's particularly their families and the carers and their partners and things like that, because they have to deal with the diagnosis as well. So it's really important that the people learn a little bit about it, and it is quite my experience is with myeloma, it's quite an individual kind of cancer. I've met a few people with myeloma and they're all different. They all present differently. They're on different drugs. And really, you know, there's no kind of like set blueprint for it. And that's why it's really important that they talk to these myeloma nurses, because everyone is different. Some people, you know, don't only last 3 months, you know, some people last 10 years.
Yep.
So it has a really different impact on lots of different people for all these reasons. But, you know, there's no cure at the moment. But when you think of a lot of other diseases, there's no cure for diabetes, but we can treat it. You know, there's no cure for blood pressure, but we can treat it. And with myeloma, there's no cure for myeloma either, but it is treatable, you know, with the right drugs. So it's a message of hope that you really need to get to a lot of these people. And because they're in regional areas, as you were saying, Carol, they don't get the same degree of support that, you know, people like me get in the city.
So it's an opportunity for Rotarians out there to do a bit of hand-holding, to do a bit of information sharing, and to maybe give someone a lift sometime because they need to get somewhere. So it's really a hands-on delivering a support service to people who need it. And the nurses play the biggest role in supporting the group, but the Rotarians' job is to support the creation of the group and the nurse and the information sharing and any other things that pop up. So it's not onerous, but it's an important service to deliver.
Yes.
So is there like a register as to where the myeloma nurses actually are? Because that would probably be a key sort of place where we could look at, A, there's a Rotary Club nearby, and B, there's a facility as to where the meetings could take place.
We don't, the nurses, as I said, there's 2 that really operate in regional Victoria. And once the clubs get established, we connect the clubs. So if we get a key person that will sit on ROMP, they nominate that, oh yes, I'm the ROMP representative for this club. They get in contact with the nurses, and that dialogue happens between the nurses and the Rotary person to say, well, okay, we've got an existing group in Traralgon, we don't have anything in Sale, or we don't have anything in Orbost or whatever. And as I was saying, with the technology, and I guess now we're coming out of the pandemic, the future is probably going to be a hybrid of face-to-face support groups and also virtual support groups, you know, using Zoom. So, so to answer your question, I think it's really a dialogue that's going to happen region by region. Some of them are already established and some aren't. It's difficult to get the specific people who have myeloma because of privacy concerns. Yeah. So we haven't got a list, but that's not to say people that have myeloma can contact the foundation directly and register their, their details. And then they pick up the myeloma newsletter, they pick up the email, they pick up the new brochure when it gets printed. So that's the kind of facility we're looking at. So it's very much a facilitation, hands-on support. If I was to sum it up, 2 pieces. The first bit's the hands-on support. The second bit is going to be building that awareness, but that will be over time. That's probably not an immediate thing, but we've got a lot of plans booked for next year. And, you know, when you think about it, if we can stream something into, you know, like a local hotel in your towns and cities and have a myeloma theme about it, it could well become like a Rotary function in a local hotel with your club, and, you know, getting behind the cause that way as well.
Right.
All right then.
Anyone got anything else I'd like to? Yes.
Yes, go ahead.
Hi, Adrian, thanks very much for your presentation. I hopped on a little bit late, unfortunately, but my name is John Tane from the Rotary Club of Frankston North. And I was very interested to be part of this tonight because I was diagnosed with myeloma 3 years ago. And the only contact that I've had has been with my oncologist, but I've never gone to any support group or anything. So just on a personal question, what should I do? Where should I start?
I can give you, if you or Carol send me your email, I can write to you and I'll give you the, there's a 1-800 number where you can contact them and register. I've got it in my folder, or I could do it now if you can just hold fire.
Unfortunately, that is a very common story. I get people who have been having treatment for, 3 or 4 years, and I say, oh, so you'd know about Myeloma Australia or you'd know about the Leukemia Foundation because they both support myeloma, and they say, nope, I don't know anything about it, never been referred. It's one of those things that you probably got a pamphlet on day one, but it's just too overwhelming. So if you can make that call to the 1-800 number, they will give you a whole lot of information that will be very useful, and probably there's a lot of help for you out there that you've got no idea that it was there.
Yeah.
Oh, good. Thanks. Yeah.
So there's 2 ways you can do it. You can ring the 1-800 myeloma number. You can email, if you've got a pen, nurses@myeloma.org.au. Or if you want to ring the head office, it's
That was nurses@myeloma.org.au.
And the head office is 03 9428 7444. So 9428 7444. And the 1-800 support line is 1-800 693 566. That's 2 ways you can go through, but I'm happy if you want to talk privately about it sometime. I'm more than happy to share notes or talk about it if I do that for a lot of people, so I'm more than happy to do that as well.
So how do I contact you, Adrian?
You've got my email off Mark, if you could send it around, that'd be fine.
Okay, fine.
And my telephone number's on the bottom of that, Mark, that email that I sent you.
And I did just send out about 10 minutes before the meeting the information about ROMP and the newsletter. So
I got your email, that's why I'm on. Yeah, but I didn't get a chance to read it. All I saw myeloma and it was on, so I went bang.
Well, if I got you on, then the email was worth it. One person makes it worth it.
But I did learn one thing tonight. You mentioned those pins and needles in the feet. I was wondering why the heck I'm getting them, but now I know why I get them. Yeah.
Yeah,
They drive you nuts.
Basically, it's a nerve reaction, and because your feet are the furthest distance away from your brain, that's where the nerve hits first. It hits first for the furthest spot in your feet. So, but you can take some. If you speak to your oncologist, they can prescribe a drug that tricks your mind into thinking you haven't got sore feet at all. So, if you send me an email, I'll give you the name of the drug. But I can speak from personal experience, it's quite effective.
Yeah, it's not a constant thing. It's just every now and then it goes bang, and
me too. When I've got shoes on, I can't feel it, but when I've got bare feet,
it's that's when it gets you. Yeah,
very sensitive. But Mark, I should say that if any of the other clubs, when you're talking to them, if you could bring up the ROMP program in their presence, that'd be great. And I'm more than happy to go and talk and do a similar, cut down long version or whatever, or even just zoom into any of their meetings. So, but yeah, that's the thinking, to get the clubs to cover that distance. So, around all of Gippsland.
Yeah. No, it's fantastic. Thank you, Adrian, and for the rest of your crew that have popped on here tonight. It's been very enlightening, I can assure you. And look, I'm happy to really promote this around. I do know that on my governor's visit, I do have a whole session, not long, but talking about the R100 stuff. And when I talk about some of the big projects that are, now can't get, it's fine, that we are doing as a group, I do make sure that I always mention ROMP and a few people certainly ask later on, what's ROMP? So might be slow, but we are getting the message out there, and I'd like to see, I'm sure that we can at least help you set up a centre somewhere or two across our district fairly quickly as well.
That'd be fantastic. Thank you.
Yeah.